Before you say, "We're going to Disneyland," it's smart to travel-proof your toddler as much as possible. First, pack a travel and safety kit to manage small scratches, cuts, or strains. Pack a copy of your child's medical history and a list of all prescription medicines that your child takes. Depending on where you're headed, you may need travel-sized packages of common over-the-counter meds, including anti-diarrheal medication, antihistamines, decongestants, anti-motion sickness medication, pain or fever meds, antacids, and hydrocortisone creams. Kids often get motion sickness, and diarrhea or colds are common while traveling. You should also toss in bug spray and sunscreen. If traveling by plane, make sure to purchase a separate ticket for your child since it's safer for him to sit in a car seat that's been okayed for use on planes. I suggest you dress your child in easy-to-remove clothing and shoes. Everyone gets a security check, and you'll make it easier on both of you if you can hasten it along. Don't depend on airplane food to feed your child. Bring his favorite snacks with you. You should also pack some of his toys to distract him from a fear of flying or just to entertain him during the long flight. To reduce ear pain, encourage your child to yawn, swallow, or drink through a straw during takeoff and landings. These actions will work to relieve the pressure. Before any international trips, check with your pediatrician to see if your child needs any vaccines. Prevent jet lag by adjusting your child's bedtime routine a few days before your trip. When you get to your hotel room, examine the room and child-proof it if necessary. With the right planning, you can make your trip as hassle-free as possible.